have physical bed capacity. So we literally had to find every nook and cranny to put patients in. We've had to build tents outside in the parking lots to house people. We've had people lined up in the hallways. We've used conference rooms as bed spaces. We've used any sort of possible place to put patients, to care for patients in this pandemic. And it's really a significant challenge. In addition, not just a physical space capacity, but there are just not, there are an infinite number of physicians. And so as Sarah had mentioned, I am a pediatric nephrologist. I did pediatric training, and I've been a pediatrician for over 20 years. And so because of the amount of people that needed to be cared for, we've actually had to recruit people outside internal medicine. So for example, I actually went into the hospital and I took care of adult patients, something that I don't necessarily have the training for adult medicine. Obviously, I have a lot of training to speak to patients, to talk to families, and a lot of the other medical aspects of it. But we've had to recruit physicians from all different specialties just to have all hands on deck to weather the storm. And so certainly it is Doctors Day this last week, and I'm certainly proud of the physicians and all the healthcare workers out there really doing it in day out to do everything we can to help our community through this pandemic. So thank you for having me.
Thank you so much for taking the time to be here and sharing that very important frontline experience that you have. Okay, last but certainly not least, we have Jamie Solis, who is our new Director of Health Services at the University of Verne. So those of you at ULV may have not already met Jamie Solis, but she is joining us today. She's also a registered nurse. Although she's new in her position at ULV, she is a well-experienced nurse who has worked in a wide variety of roles, all while being exposed to a vast range of perspectives, cultures, and workplace settings. Her most prominent previous positions include working on the front lines in an ER and was the Director of Nursing for the Southern California branch of the Indian Health Services. Aside from her work experience, she recently received her Master's of Science in Healthcare Administration. Thus, using a combination of her vast hands-on experience and her formal education, she is and has been successful in her implementation of new policies relating to general public health care, nursing protocols and procedures, and well-regarded COVID-19 policies. Since the onset of the pandemic in 2020, Jamie has been diligently researching the developments regarding COVID-19 and has been deeply involved in vaccine implementation for underserved populations. She was able to create a coalition with her staff and organization to rapidly begin vaccinations during the first shipments of the vaccine and thereafter. She takes most pride in being able to tap into her own personal knowledge and the experience of those around her to best approach all situations she encounters. She's honored and excited to work with the university and its students such that she's able to best accommodate and care for all persons and provide peace of mind during such a stressful time. She's married with 2 sons, one of whom attends ULV. Welcome, Jamie Solis. Please feel free to share any opening thoughts with us.
Thank you so much for having me. I'm really excited to be here and talk about COVID. Thank you.
Wonderful. Well, let's get started. We're going to start out with some prepared questions for each of our guests, and I'm going to start with Dr. James Tong with some more medically oriented questions around the vaccine. So Dr. Tong, tell us a bit about just the landscape of the vaccines available in the US today.
Great, thank you so much. So we currently in the United States have FDA approval for 3 COVID vaccinations, all of which are under emergency use authorization. And I'll just kind of go through them by the time frame that they were rolled out. So the first one that did come out was the Pfizer vaccination, and it is a messenger RNA vaccination platform that has 95% of efficacy in preventing symptomatic COVID-19 infection after the second dose. It is a 2-dose series, so it does a 2-dose series that is currently about 21 days apart, and it is approved for ages 16 and over. The second vaccine that came into the market or was approved by the FDA was the Moderna vaccine. This also is a messenger RNA vaccine that has 94% efficacy in preventing symptomatic COVID infections. It is also a 2-dose series that is 4 weeks apart, so 28 days apart, and it is approved for ages 18 and older. The most recent vaccination is the Johnson & Johnson vaccination. This has a different platform. It's an adenovirus vector platform that has, in the United States, it has about 74% efficacy in preventing COVID-19 infections. The value, or the nice thing about this one, it is a single dose vaccination, so there is no return slot that's necessary for that, and it is approved for ages 18 and older.
Perfect, thank you. Should people hold out for one of these over another? I know we're hearing kind of the differences in efficacy rates. Can you speak to that?
So that's a question we get a lot, and people obviously always do get focused on the number. And so the one thing that I would say is that all vaccines are really, really good at preventing infections. All the vaccines are extremely, extremely good at preventing serious consequences such as death and or hospitalizations. And so to date, to my knowledge, there has been no one who has passed away from COVID-19 who has been fully vaccinated from the vaccine. So I just want to make that clear. When we talk about efficacy between the two different, or the different vaccines, a couple things to notice. One is they were done at different time periods, and so they may have been different strains that were out in the community at that time. In addition, the efficacy was looking at preventing, or that efficacy number is looking at preventing infection. And so there are some differences there, but the most important part, which I think we all care about, is hospitalizations and death, and all do a very, very great job of that. So to answer the question, sort of to be short, is that our recommendation is to get any vaccine that becomes available to you, regardless of brand.
Thank you. So sometimes, not sometimes, a lot of the time, we hear that some of these vaccines were developed so quickly, and this makes people concerned about safety. It seems like this sort of historic timeline for vaccine development. Should we be concerned about the pace at which these vaccines were developed?
So it is true, right? The COVID vaccine did come out in I would say a record time in terms of vaccine language, or normal vaccine standpoint. But it doesn't mean that corners were cut. So in development of any vaccination, safety is the first priority. The clinical phases of clinical trials that we do for drug and or vaccine stages for approval are, there's phase 1, there's phase 2, there's phase 3. All of the safety trials and all the efficacy trials, there were no corners that were cut. So for each of the vaccines, about over 45,000 healthy volunteers volunteered to be part of the study. And that was a really good sample to make sure that this is a safe area, or a safe vaccination to give. The areas that were cut, and I wouldn't say they're cut, normally in vaccine production, things are done in series. And so you go to the next step after one step happens. But because of such a high impact of the pandemic, there were a lot of things that happened while we were waiting for approval, while we were doing the clinical trials. So for example, while the clinical trials were still happening, governments did invest in a lot of the manufacturing infrastructure to be able to rapidly produce the vaccination. Those generally don't happen in normal standpoint until after the clinical trials were completed. The other thing that did happen was the mass production of the vaccines itself were started on very early on, prior to the final FDA approval, because we wanted to make sure if and when it did get FDA approval, that we were able to roll out quickly. So the parts that the ethical parts of creating vaccines and the safety parts of creating a vaccine were not cut. It was just really the manufacturing portion that was done in parallel as opposed to in series.
Thank you. That's really helpful perspective. So, we're hearing a lot about side effects, and, particularly I'm hearing Pfizer, Moderna. I had the Moderna vaccine and I did have some side effects, but, it's been several weeks and I'm okay, but we are hearing a lot of talk around side effects. Are there any side effects of the vaccines that we need to worry about? And should we be worried about the more long-term side effects of vaccines?
Yeah, so certainly, I'll just sort of share with you, I got the Pfizer vaccination when it was first available to me, and I didn't have any sort of side effects after the first dose. After the second dose, I had some muscle aches, some chills for the next day following it, but 2 days afterwards, I was essentially 100%. So the most common side effects are the ones that I just described. They're really called what I would call a term called reactogenicity, which means that your immune system is reacting to a substance or a body that it recognizes as being foreign. And so these are short-term side effects that mostly result in local inflammation, which is just redness or swelling around the injection site. Or sometimes you can get more generalized side effects such as fevers, muscle aches, fatigues, headaches. So those are the most common ones for all three of the vaccinations. These side effects are typically last about 2 days and do not have any long-term consequences or long-term side effects. There are more severe but very rare side effects that I do like to mention called anaphylaxis. So what anaphylaxis is basically a really severe allergic reaction that causes you to sometimes have respiratory distress. Your airway or throat can kind of close up from that standpoint. And so the incidence of that for the Pfizer vaccine is 5 in a million. And the incidence for that in the Moderna vaccine is about 2.5 cases per million doses of vaccinations that are given. Obviously, those are very, very rare occurrences. Even so, we still show a significant amount of overabundance precaution. And so after the vaccination, we do monitor people for anywhere from 15 minutes to 30 minutes, depending on your history of allergic reactions. So those are things that we certainly do look at from there. As terms of long-term side effects, as of now, we are not aware of any long-term side effects besides the potentially life-threatening ones, the anaphylaxis that we just talked about. We have really reasonable data to at least over 100,000 people in the clinical trials that don't have any long-term side effects at this time. The other piece that I would also just share is that, you know, for Kaiser San Bernardino County, we have about 1,000 physicians, and 95% of those physicians have been fully vaccinated. And so it kind of goes to sort of, we like to practice what we preach. We do think that this is an important piece. And yes, there might be some short-term side effects, but certainly the benefits certainly outweigh the risks in my mind.
Thank you so much. And I want to acknowledge the chat that folks are putting questions in, and we will get to those. So have no fear. At the end of the sort of prepared questions, we will get to the chat. Thank you for contributing your questions. Okay, can vaccinated people transmit the virus? This is one I'm seeing a lot of sort of up in the air info about.
Yeah, it's a great question. So the quick answer to that is at this time, it is not definitively clear whether the fully vaccinated people can transmit. There was just a study this past week, though, that it did show that fully vaccinated individuals are 80% less likely to have any virus in their nostril compared to those that were not vaccinated who are still asymptomatic. So it's most certainly that there's obviously a much lower likelihood that you can transmit it, but those reports or those studies are still ongoing. So more to come with that, but all the evidence is showing that it's be rare to transmit the virus for a fully vaccinated person.
That's really hopeful information. I hope that evidence just keeps growing over time.
Exactly.
So with that in mind, should vaccinated people still wear masks?
Yeah, so the answer is yes, and then partly because we don't have definitive guidance or data to that from the last one. So it's really important to continue vaccinating everyone, but who knows who the next person is that you're next to in line at the grocery store, who knows who they're going to contact. And so at this point, it's still really important to continue masking, even if you've been fully vaccinated. And it's really important to continue social distancing and hand hygiene effects. Those are some of the basic stuff that we've been discussing ever since the pandemic, just because that data isn't fully definitive at this point.
Okay, thank you so much. And then generally, are we seeing the vaccines working in terms of bringing transmission down? Like, how is it looking right now? Is it helping?
So the answer to that is it's a tough question to say. So I would say the vaccine is working. We know that people who have been vaccinated are significantly less likely to, aren't having any issues or transmitting infections or diseases from that standpoint. The kind of the trick piece of that is you need enough people to get vaccinated before you can see a downtrend in transmission. So just this past, as of Monday, in the United States, about 15% of all people in the population in the United States have been vaccinated. In California specifically, where we live, that number is about 14.6% of the population in California. So even though the vaccine is effective, if you have a small minority of those people fully vaccinated, you can still have a significant trend. And that's kind of where it's essentially a race, right? It's a race to get more people vaccinated while before the variants that we're seeing, like the UK variant that we're seeing, which is more contagious, sort of become rampant. So that's why it's really important is when you can get the vaccine to get vaccinated as quickly as possible. Ultimately, to get what people call herd immunity, we need about 60 to 70% of the population to be vaccinated or immune. And so that's why it's a race to get those to that time frame.
Thank you so much. We're going to switch gears in the conversation here, but I know we'll be coming back around to you with these Q&As popping up in the chat. So at this point, we're going to shift and ask some questions of Dr. Gail Evans Grayson. So we want to, make sure that in this conversation, we have ample space to talk about equity. As we look back on the history of medicine, public health, and biomedical research, we know that there have been just outright atrocities in how these fields have dealt with Black and brown bodies without consent. So we do want to carve out part of this conversation to talk about trust, to talk about, acknowledge that history and turn the conversation a little bit toward equity. So thank you so much, Dr. Grayson, for being here and sharing your expertise with us. What would you say we've collectively learned about health equity in general during this pandemic?
That as a society, we need to be honest and transparent, that we need to address the racial disparities and inequities that both the Black and brown community has been structuralized and impacted for over years. What the pandemic has done is has ripped the Band-Aid off in terms of having a conversation, how we can talk about the health inequities and what we can do differently. Because when we think about just the state of California alone, the Blacks that have received the vaccination is 3%. And looking at the data, Hispanics, 22%, Asians, 14%. But when we look at the number of death rates, our Hispanics, our Latinos, they're ranking at 41%. And so because of that, that is a key indicator that we need to go into these communities and have a conversation, a real conversation that includes and or help them to make an informed decision whether they should or should not take the vaccine. And because of that, we have to remain transparent. We also need to address in terms of how do we get that information to them versus through the use of technology. We need to identify ways where we can go into the communities and have where the tents were set up at the hospitals. Perhaps tents needs to be set up in the communities of color where we can engage and have those conversations. And so with that, I think about what can we do to minimize the barriers? What can we do to help individuals to understand where we are? And how can we remove ourselves from being penalized for what has happened to us for so long?
Thank you so much. Is it important for groups in these communities that you're describing, in your opinion, to obtain the vaccine?
I am not here to promote the vaccine. I can speak to only my truth and stand in my truth. I have received the vaccine, and I have received the vaccine because I have a pre-health condition. I have a pre-medical condition. And so in order to engage my parents, to engage my children, I took the chance and I did my research and I made an educated decision that benefited me. So to answer your question, I can only tell individuals what has happened to me. and how it has impacted me. And I have done the research to make my own informed decision. However, what I will educate and say here on our conversation today is before we speak negative of the vaccination is that we do our homework and that we identify what we can do to either make a change in addressing the health equities. What can we do to minimize the structuralized racism that has been going on for decades, for years and centuries, what we can do differently. When I think about the structural disadvantage, I think about those that have the stigmatized conditions, as I mentioned earlier, and the challenges in making a decision is we're not informed. Our healthcare literacy is, ranging anywhere from 6th to 7th grade when we talk about our seniors. And that's not a flaw for them in the educational system. However, they have not been educated properly in a way that they understand. And so we are always in a position to listen to reply, but perhaps we need to focus more on listening to understand those issues before we continue to work with those vulnerable communities. I also talk about the decision-making in the pandemic. How can we exacerbate the existing marginalization that both our Black and brown community have experienced? And so with that, we have to continue to remain a work in progress, and we have to continue to educate those. And we also have to support those resources such as the churches, other community nonprofit organizations that's trying to get the word out. We need to take our funding that public health, state, federal dollars may have and make sure that those particular resources have what they need as a viable option to continue to educate those.
Thank you. It's great. You were sort of touching on this, but how can we dispel the myths of the vaccine to communities that distrust the healthcare system?
One of the things that I have done in some of my research is we need to implement a fair and anti-racist policy that impacts everyone, and that includes our education. The mistrust is rooted in structural racism, as I spoke about earlier, and that it leaves our Black and brown Americans behind in the quest to get vaccinated. They don't know what to do because either they have been misinformed, they're still not trusting our system, they're not trusting the communities that they reside in because of things that have happened to us over the years. And knowing that this is not a one-size-fits-all approach. We have to unpack the hesitancy. We have to be effective in knowing that in order to have a dialogue, we have to have those courageous conversations. We also need to talk about the modes of the systematic barriers. When I think about where individuals can go and get vaccinated or can receive the vaccine, it is a barrier, it is a hurdle for a lot, especially in those communities of color. Not everyone has access to technology. Not everyone can stand in long lines. Not everyone has the means to make the phone call and remain on hold. And so with that, we need to figure out what we can do to address misinformation that's being provided and helping individuals to make the informed decision that they need.
Great. And then my final question for you at this point is what lessons about health equity, what lessons about health equity should we take forward as COVID-19 hopefully continues to decline? What can we take into the future from this experience?
That we educate in the ways that resonates with every patient. And again, I see some of the comments that it's just not about brown and Black communities. It is not. However, we do have one of the highest rates of health inequities and disparities, but it's for the common good of us all, regardless of our skin. That we leverage our community partnerships, that we talk about how to advocate on efforts to address COVID-19 and its disparities, share what we learn, what our fact findings are, what our key research says, and then rebuilding and reimaging the healthcare system in its form of delivery. And again, to those marginalized groups, and ensuring virtual care is effective because it is here to stay. So how can we continue to increase our telehealth efforts? How can we continue to go with our mobile trucks or our mobilization teams and go into these communities to have these conversations?
Well, thank you so much. Again, I know we'll return to you with the Q&A, but I really appreciate you sharing all of that perspective. So finally, we're going to turn some questions over to Jamie Solis before we open up to what we've seen in the chat and any other questions you may want to enter. So as we know, COVID has impacted all age groups, but especially, you know, with the most kind of severe outcomes, it's been a lot of older adults. But it seems like young people are making up a large portion of new COVID-19 cases. Should young people, given that they're not typically the ones that have these extreme outcomes, should they still consider getting the vaccine?
I definitely think so. I mean, I'm not here to promote the vaccine in any way, but I am here to promote the good of the community, you know, and our family. So I think to keep our family safe, we should all get the vaccine, right? So even if they're not going to be the ones that are going to get extremely sick, they might be able to carry it to their family members that could. So I think it's very important to remember, you know, that college age students are in close quarters a lot of times, in dorms, you know, in athletics, in classrooms. So it's important, I think, that they get the vaccine so that they protect themselves, their family, and their community.
Thank you. Who is eligible for vaccines now, and when do we anticipate students and adults of all ages with no underlying conditions will have access to the vaccine?
So currently, those 16 to 64 with underlying health conditions, those in healthcare, agriculture, food, education, childcare, you know, any first emergency services are eligible currently. But this week they did release information that as of April 15th, it's going to be opened up to 16 and older, which is really exciting. So yeah, it looks like that anyone, they don't even have to have an underlying health condition. April 15th, it's opened up.
Okay, so that's a big development that everyone will be, okay, eligible April 15th.
Yes.
Once folks are eligible, where can they sign up for the vaccine? And then where do they sign up for the second one? How does that work?
So the easiest thing to do right now is to go to myturn.ca.gov. As it stands right now, it's designed for those that are eligible. So it asks you some really simple questions, you know, where do you work? How old are you? Do you have underlying health conditions? And if you answer no to all of those, which most college age students will, it takes you to another page that has you enter your contact information, and they can you can enter that in, and then they can text or email you when you are eligible. So when that April 15th marker comes around, you'll get a text or an email letting you know, hey, it's your turn, and you can follow this link, and then you can then sign up, and it'll direct you to your local vaccination site. And usually you get your second vaccine appointment when you sign up for your first one. If you don't, you might get it at the time of the actual vaccination. So don't leave your vaccination without your second appointment, because that's really important to have.
Great. Yeah, assuming it's Pfizer and Moderna instead
Well,
of...
exactly. If you require a second vaccine, exactly.
Okay, wonderful. And then would you kind of generally, for those, you know, who are curious and haven't been through this with a loved one or themselves, would you describe kind of the process of getting the vaccine? Like, does it cost anything? Do you have to bring documents? Are you going to wait a long time? Sort of what does it look like?
It's pretty simple process. They've really streamlined the process down. A lot of places are doing drive up. Those that aren't doing drive up, it's a walk up, very streamlined process. It doesn't cost anything. It's free for all Americans. They don't need to bring any documentation unless there was something their doctor specifically instructed them to bring. You show up to your appointment, obviously wearing a mask, wearing something that's easy to access your arm, you know, that you can pull up or down, and you should be in and out fairly quickly, but you will have to wait that 15 to 30 minutes, as Dr. Tong had said, so that they can observe you and make sure that, you know, no adverse reaction did take place in that time frame. But it should be a pretty streamlined process, depending on how many people are at the site that day for their vaccinations.
Thank you. And I know I've seen when I've helped people kind of check in for the vaccine for the second one, everyone brings that CDC card.
Exactly. So you'll get the card at the first appointment, and it is important to bring it back for their second appointment so that they can sign off that you've had the second one and put all the information down.
Great. It's kind of a new feature in a lot of people's wallets now. And then finally, how can people take care of their health after they've had the vaccine? So, you know, both in terms of those couple days where you may have side effects, but then also moving forward.
So, I mean, in those couple days following the side effects, it's to be expected, right? That you aren't going to feel well for that 24, maybe 48 hours. Ibuprofen, rest, fluids. I mean, it's the basics. You know, you'll get through it. You know, that's the good news. I had side effects for about 12 hours that were not so fun, but I felt like it was definitely worth it to go through that. And then I think it's important afterwards that everyone remembers to continue to wear the mask, to do good hand hygiene. That should be continued on regardless of COVID-19 or not, right? I think it's important that we social distance, and then to stay away from others if you're sick. And to stay away from others that are sick. So it's been in the past, oh, I have a cold, oh, I have a flu. Everybody still went to work and gathered. I think right now it's important that we do take extra precautions and stay away from those that are sick. And then not to forget about our mental health. I think it's really important given this past year and how hard it's been for especially college age students, you know, the isolation and being away from school and their friends, that, you know, they do utilize any resources that are available. So here at the university, we have, you know, CAPS, they can call and get an appointment and speak to somebody. But I think mental health is part of your health, and we don't want to forget about that.
Thank you. I appreciate that focus on mental health as part of taking care of one's health. That was my last prepared question. We now have over 20 minutes for the very active chat. As I scroll back up to some of what's been said, let's start with this comment from T. Williams. And I think, Dr. Grayson, this might be one for you to comment on. So T. Williams says there's a lack of communication in all communities. However, we must not ignore that medical experimentation and abuse was done on African Americans for centuries. This is and continues to be a major contributor to the mistrust in Black communities.
Absolutely. There is so much truth in that. When we think about the Tuskegee, when we think about what happened with Henrietta Lacks, you know, there are a number of things that have gone on that we have either been used as cases in order to identify whether or not the vaccine was going to work for those that may not look like us. And so that comment is very, very true. Again, these are conversations not necessarily about the politics. These are conversations that has happened and that has been documented and has been researched. And so because of that, my goal is to share what is currently going on and how we can continue to make informed decisions. However, we cannot make those informed decisions if we have not been properly informed and or educated. And so with that, the comment made by T. Williams is absolutely, we have to engage in having a conversation, and that starts with us.
Thank you so much. So as I scroll back up, there's a lot of activity around side effects. And I'm gonna sort of bundle lots of comments and questions here. So, you know, some folks are sharing that they had what felt like more severe reaction to the vaccine. Some are sort of sharing, well, we haven't been vaccinated for that long. So how do we really know about these long-term side effects? So I think, Dr. Tong, maybe for you, with these concerns about, you know, unique experiences around perhaps a more extreme side effect that are not as much sort of in the news, and then also that length of time for vaccines and how we know about long-term effects.
Yeah, those are all really good questions. So I've been monitoring the chat, really great questions from the group here. So I will try to hit on all those things that I saw in terms of side effects in the chat. So a couple of things is, by definition, a fully vaccinated individual is 14 days after the last dose. So if it's for Moderna or Kaiser, it's 14 days after the second dose. If it's for Janssen, it's 14 days after the only dose. And so I want to be clear on that, because one of the chat was about becoming positive after getting the first shot. And that certainly can be possible. It doesn't, you know, once you get the shot, it takes your immune system time to rev up to recognize and create antibodies towards what the vaccine was for. And so it's certainly possible to get become positive in between shots or shortly thereafter. And so that is always a possibility. So that's why it's still really important. You wouldn't be considered fully vaccinated from that standpoint. And that's why it's still important to wear your mask and be social distancing from that standpoint. In terms of long-term side effects, so I do want to be clear, the technology isn't new, right? So the mRNA platform that the Moderna and Pfizer vaccinations are built on was actually from 2005. We've used it a lot in cancer research. We've used it a lot in HIV research. So the platform isn't new. What's new is what's introduced into that platform to become immune to. And so we do have lots and lots of data back from 2005 with this mRNA platform that we don't see any long-term side effects. And then for the adenovirus, the Janssen, that's actually been used since 1985. So even a longer period of time where we're using the platform, what we're doing is just exchanging what we're using the platform for to become immune to that specific virus. Then the other couple of things with side effects I do want to make note of. Just because two things happen at the same time doesn't mean there's a causation. And so it's really important to note because, so the most publicly known that you guys probably are aware of is, AstraZeneca, which is in Europe right now, not approved for US. In Europe, they actually held 1 week of AstraZeneca vaccinations because there was concerns that there was DVTs, which is deep vein thrombosis or blood clots in the legs. And so they actually held it for a week, which is millions of vaccines that they did not give. And when they looked back, there was no increased risk in the baseline rate of these blood clots. So unfortunately, bad things happen to people regardless of whether you get the vaccine or not. Just because it's coincidental, it doesn't mean it's a causation part of it. And so I just want to be clear on that. That's always a big piece of it. And then finally, someone had put in the chat, when was the first specifically the first vaccination for Pfizer? The big phase 3 clinical trial started in July of 2020, and so we have hundreds of thousands of people who have been vaccinated, and so we have that data specifically, and we don't see any long-term side effects from that data. Did I, Sarah? Did I hit all the side effects for the vaccines that we talked about?
I think that's great. I'm sure I'll have more questions for you as I kind of mosey along in the chat here, but that's wonderful. And I think, that correlation, not causation, that was a big part of my public health education. So let's see here. The question I think around that first vaccine and sort of contagiousness, I think had another bent. I'm looking at Maddie's question. So she's saying that she knows multiple people who have gotten the first dose and then someone in their family tested positive. Is that related? So in other words, can getting the vaccine make you contagious? So
no, there's only there's a couple of theoretical live virus vaccines. So MMR, varicella, measles, mumps, rubella, varicella are live vaccine. All the other ones and all the COVID vaccinations are inactivated. So they don't actually have any ability to replicate from that standpoint. So you cannot get the virus you can't get the COVID from the COVID vaccination. And that's why they either got it from that person or they got it from, the community.
I'm just going to add a little piggyback here before fielding a question to Jamie. One concern I've heard with the mRNA vaccines is, does it affect your DNA? Does it change your DNA? That's for Dr. Tong.
Oh, okay. Yes. So it does not, right? So it basically gives your DNA instruction to make the spike protein. So the spike protein is what is thought to be the most infectious part of COVID vaccine. That you guys always see that little gram where it's a ball with these little spikes on it. And so it instructs your DNA. It doesn't go into your cells, but it instructs your DNA to make those spike protein. And that's what your immune system becomes targets that. There were some other questions, so thank you. This kind of just triggers all the other questions that are out there. There was a question about fertility, and that was an initial concern because there's ACE receptors on the placenta, and there's ACE receptors on the COVID spike protein, but those have been, they're completely different genetic materials, they're different constructs, and so there has been proven to not be true in terms of infertility in women.
Thank you. Yeah, that's one that I've seen sort of floating around. Jamie Solis, Hugo is asking if there's any vaccine distribution plan for college students like them once the vaccine becomes available to university students.
So currently I can only speak for the University of Laverne right now. I would love to have the vaccines here, but because of the requirements for the freezers and stuff like that, we don't have the capacity to house them. So long-term goal would be to get the Johnson & Johnson vaccine because it's a 1 dose and it doesn't require that freezer capacity. That would be the goal, but as it stands right now, that's a long-term goal. It's not happening right now.
Okay.
Perhaps
great.
there may be an opportunity for us to partner because Western University is administering the vaccine.
Mhm.
We currently have administered over 10,000 vaccinations. And because of that, maybe again, community working and communicating together, we could collaborate because we're right down the street from you all.
That'd be wonderful. I know we've been collaborating to get our faculty and staff vaccinated.
Mhm.
And I went and volunteered at Western U the other day, and it was great to be on the other side of sort of that hopeful process. So
Absolutely.
talk more. From Carol, I think this could be Jamie Solis or Dr. Tong. Is there anything I should do to prepare for my vaccine shot? For example, abstaining from weed, alcohol, or coffee the day before?
I could take that one. So there isn't anything specific that you should abstain from in terms of foods or foods or drinks. So what I would say is, though, we don't recommend taking ibuprofen prior to the vaccination. And so there's a theoretical risk that it might blunt your inflammatory response. And so you might not get a robust of an immune response that you would normally do. We actually recommend the same thing for kids getting their 2-month and 4-month and 6-month vaccinations. We actually recommend not pre-treating them with Tylenol. And so same thing is not to afterwards, if you have mild side effects where you have a fever, you have muscle aches, no problem. You've already had your immune response. So no problem in taking ibuprofen afterwards. The only, the piece about alcohol, I would just warn to is, you might feel not that great the next day. And so alcohol is certainly not going to make that feel better. So I would just do fair warning from that standpoint is you don't want to make yourself feel a little bit worse, at least temporarily. And then I'm just going to tag along. Allison had a great question about, how long is the vaccine good for? And there was another great question about, if I've gotten COVID before, do I need to still get the vaccine? So if you have gotten COVID before, the recommendation is absolutely still to get the vaccine. We've seen already in that the antibody strength and titers of those who've gotten COVID in disease infection is lower than the people who actually have been vaccinated. So you have a much stronger antibody in those that have been vaccinated versus those that have had just had the natural infection, so to speak. In addition, the variability of the protective antibodies post-infection are varying from different person to person. So there's no, I can't tell you everyone's gonna, at 2 months, you're still gonna be fine. 3 months, you're gonna be fine. There's certainly some protective, immunity when you do get the COVID infection. The people in the second surge who got the COVID infection didn't really get in the third infection. So the third surge, but it's certainly weaker than the actual vaccine itself, and it's unclear, and it doesn't last as long as we don't think. In terms of how long it's going to last, that part is unclear. With all these variations and these variants that are out there, the vaccine will likely also change, kind of like the flu vaccine. And so this likely will be something where every year we're going to, just like your flu vaccine, we're going to get the COVID vaccine as well.
Yeah, absolutely. I've heard that with boosters. So there is a question from Cassandra that I don't want to gloss over, but it's more about she has some specific respiratory issues. I don't know if you saw that, Dr. Tong, and she was sort of advised against getting the vaccine because of her specific respiratory issues, but wants to know our thoughts as of today based on, the vaccine being ongoing and open to almost everyone. And I'm going to guess that the recommendation here is really to stick with talking to her personal physician, but curious if you have any thoughts.
I would agree. I mean, yeah. So in general, Cassandra, thank you for being so open and transparent in this group. So thank you so much. And I obviously this is something that you're very seriously considering. Gleaning from the information that I see, there's none of those things are contraindications to getting the COVID vaccine. Obviously, you have a lot of allergies, and you're going to be one that I would say should be monitored for 30 minutes post. And when people have these issues, by and large, you're going to, if you have a reaction or anaphylaxis to the vaccination, the overwhelming majority will have it before 30 minutes. And so I would say, I don't see anything that is a contraindication, and you should wait the 30 minutes for monitoring.
Great. This might be for you, Dr. Grayson. I'm not sure if you're familiar, but what were the demographics Kayla is asking for those that participated in testing the vaccine?
Now, I do not have those numbers. What I do have is just a breakdown of those that have received it based on their ethnicity, the number of cases, the number of deaths, and then the total population. So my apologies, I'm more than happy to go through those particular data and or stats I have before me, but I do not have that number.
No problem. And Kayla, this is something too, if you'd like to stay in touch, I'm happy to look into it more deeply. But my understanding with all of the clinical trials was that there was an immense effort to make sure that those involved in clinical trials and that the demographics of those populations as close as possible match the demographics of the general population. So in other words, I know that at least for Pfizer and Moderna, that there was immense effort to make those samples representative. And it's a great question. But again, if you want to stay in touch, I'm happy to look into the specifics for you and get that out to you. So Jamie, this one might be for you from Diego. If healthy young people without any pre-existing conditions choose not to be vaccinated, can they still return to, let's say, University of Laverne? This is going to differ, based on school and public offices. And he also says, is the vaccine going to be vaccinated in the state of California? I'm not sure about that second part, but I think the main question here is, can healthy young people sort of choose to not get vaccinated and return to campus and public offices?
So right now, there's nothing out there that says anyone has to get the vaccine. It's strongly encouraged. The university, as far as I know, which again, I'm very, very new, I know there's been a lot of conversations about those that are going to stay in dorms or be involved in athletics, that they would really like them to be vaccinated, but there's nothing right now that's mandating them to be vaccinated to come back, as far as I know.
Okay, thank you.
I do know, I did want to just add, Sarah, I am aware that the federal guidelines are looking at imposing a particular law, whether or not individuals will need to have the vaccine as early as those that are in elementary, middle school, and high school. Similar to the immunization records that are required for those to enter into school, as well as at the college and university level as well. So I know that they are looking into that. And so just to reframe, it may lend itself where it will be infringed versus voluntary.
Yeah, thank you so much for that. And something to note just generally about public health powers, meaning, what the state can sort of impose versus not. They can do more with state and public agencies, right? That's why we see with public schools, you can require vaccines. With private schools, they don't have that same power, which is why I sort of noted this is going to look different depending on the kind of institution that we're in. University of Laverne is a private institution, so we may end up looking different than, your local high school. But as Dr. Grayson mentioned, this is hot topic in legislation, so I think it remains to be seen. But at this point, as Jamie Solis mentioned, we don't have any policies that stand for University of Laverne that require this. So Kimberly asked a great question, and I'm noticing we have 5 minutes left, and I don't think we'll get to all the questions here today, but you all have been wonderful. We'll get to as many as we can. Kimberly asked, the vaccines currently have emergency authorization. When can we expect this to move to a fully regular authorization?
I could take that one, Dr. Rodman-Alvarez. That's a great question. So all three are under emergency use authorization, which means that they have been definitely proven to be likely to be helpful in terms of curbing or effective. And so for the EUA, which in short, you need 2 months of data to show efficacy and safety. The full FDA, we expect to be early 2022, after a year after the EUA. So Pfizer 2022, early 2022.
Thank you so much. Let's see here. Can you send out, I'm seeing Kimberly, can you send out some answers to questions we didn't get to during the session via email? Yeah, Kimberly, that's a great idea. I will make sure that we sort of record the chat here. And if we didn't get to any specifically, we will try to collect those answers and email out to participants. So, and a couple of people are mentioning the dorms. So we've been told that those who will be chosen to live in the dorms will be those that have been vaccinated first over those who have housing insecurities. So those who have housing insecurities are most likely not going to get a dorm. That's a question. That's my understanding from the housing email sent. You know, Kayla, unfortunately, I am not familiar with that housing email. I don't know, Jamie, if you are familiar with that, or if there's anyone on the call. I'm taking a look at the participants who—
Allison might know.
Is Allison Bickeran on the call?
She
I hate
is.
to call you out, Allison, but if you want to unmute.
I was afraid I was going to get tagged in.
Sorry, I was waiting.
So hello, everyone. Just briefly, I'm Allison Bickeran, the COVID-19 compliance officer for the university. We are in the process of establishing what those ultimate policies are going to look like. We are definitely encouraging vaccination in that particular population. We know that communal living is a significant risk factor for the spread of COVID. So we want to make sure that we're emphasizing the importance. I'm hoping we have some student residents on the call right now, getting some good information. So right now, that's the space that we're in. We do expect to continue to get more information about generally the state of COVID, but specifically for us, the LA County Department of Public Health, any guidance, recommendations, restrictions, they've told us that we should have a much better idea about the whole picture of the fall come the beginning of June. So right now, we are certainly emphasizing it within with all of our students, but especially within those communities that are going to have a higher risk of transfer. But there is nothing at this point that's set in stone. Fortunately, we have some really great people that are advising us. Jamie's keeping us up to date on everything. So that's kind of where we stand with that.
Thank you, Allison, for jumping in so last minute and just being willing to kind of, you know, turn on the camera and jump into the fire there. So I am just noting that this has been such an active chat, and, you know, this is a hard and very hot and pressing topic. And I just want to acknowledge that this is a choice that's very personal to a lot of people, but of course it's also about our community, our sense of community and our sense of community duty. And it's a personal choice, but it impacts those around us. And it's so layered with some of the topics Dr. Grayson has spoken to today, with just how sort of quickly and intensely this pandemic has hit us. So I really appreciate you all just taking the time to educate yourselves and participate in this conversation and bring to the table your different experiences and being open and asking questions. I am sure that I have not gotten to all the questions in the chat because it was such an active one, but we are copy and pasting everything from the chat to make sure that if there's anything we didn't get to, I will send it around to our panelists, and hopefully we can come up with some good responses for you and send that out to all of the participants who are here today. If you did not register on Campus Labs for this event, please put your email in the chat so we make sure that we get you those answers as well. Because if you didn't register, we don't have your information. Please just take a moment, if you would, and join me in thanking our incredible panelists who have shared their very diverse expertise with us today and who have taken the time out of, their professions to be here with us at University of La Verne. Thank you so much, Dr. Grayson, Dr. Tong, Jamie, Solis. Really, really appreciate your presence, and thank you for the active participants. That's a wrap for us today. I will stay in the Zoom room in case anyone has any questions, any issues. And other than that, we're all done. Thanks for being here.
Thank you.
Thank you all.
Bye-bye.
It was a pleasure, everyone. Thank you.
Thank you so much for being here.
Thank you for having us. I appreciate it.
And Dr. Tong, I spent the morning in pediatric urgent care. I should have just waited and
should have
zoomed with you.
It would have been faster.
It sure would have.
I sent you guys a question 3 times, and it's a question that I don't think any of you really want to address, because it dispels all the rhetoric that we hear. And I think that's why there is mistrust. And if, as a PhD person who is used to research, if I cannot get answers, then what Gail said, how would less educated, less technology savvy person can get answers? Okay, and I'm sorry to say that James or Dr. Tong, you're wrong, okay? You're wrong, because there's a lot, I personally know 4 people with the same problems that I have, and I'm just one person. And my doctor is telling me I have no clue what to do. The CDC is not telling us anything. I spend $1,000 on tests because my doctor is fishing. And this goes back to, I'm sure that a lot of the people that Ms. Grayson is talking about, or Dr. Grayson, I don't know, don't have $1,000 to go and spend on fishing expedition because they have a fact and the doctor is saying, I don't know if I can tell you to go get the second one. How many people are not going back to get the second round because they have side effects and the doctors have no idea what to tell them? I personally know 4 people, just from my own friends, all have the exact same side effects that I do, plus other ones that have other side effects. Okay, and I actually read all the medical papers that were published on the Medical Association, the American Medical Association journal. And it wasn't 50,000 people. It was 50,000 people for a short term. It's only 8,800 people for long term, and 4,400 of them had placebo. And out of those, 0.4% were told not to go back to get the second one. But nobody's talking about it. Okay, how can you tell me that it's 100%? Everybody's talking 1-2 days. Okay,
if it's okay with you, because it is Dr. Grayson, and I just need to address
I'm
a couple.
sorry, I wasn't sure.
No, it's okay. I think we have to understand that this is not a one size fit all. And I think what we also have to understand that some of us may not be successful in receiving that vaccine. However, the majority are. And in order for us to establish some form of normalcy, we have to take our chances. And everything is a risk. But that doesn't necessarily mean, again, that everyone is going to respond the same.
I understand that.
Our body is a machine. You can't put oil in one car and different in another car, as an analogy.
That's not my point. My point has to do with information.
But what you have to understand, though, is the mistrust comes from you as well when you speak when you speak negatively of your health-related issues. And because of that,
I spent 3.5 weeks and $1,000 on
but some of us
I called the CDC and I called the FDA and I called the Kaiser. My problem is not the side effect. My problem is information. If I personally was able to find out of my friends 4 people with same effect, why is it that it's not collected? Why is it that nobody is actually taking this information and sending it to the doctors. So the doctor said, okay, we understand that there are people with these kind of effects.
However, when you speak negative of what's going on, you're creating and you're expanding on the mistrust for the good of the group and for the good of everyone. And so because of that, I understand your level of frustration, and I'm not here to discount it, but I would caution you the types of information, I should say, that you're sharing, because we just had a group of 50 plus people. I don't know if we were able to even encourage, inspire, or motivate someone to get a vaccine based on the responses provided in the chat. And so because of that, we have to hold ourselves accountable how we share information.
Well, the only reason that I found the other people is because I shared information.
I think what's really important here, and I so appreciate Dr. Grayson for jumping in here. I mean, Anat, can I call you Anat? Is that okay?
Yeah, that's fine. You can call me that.
First of all, I'm really sorry that you've had such a negative experience with the vaccine.
I don't need
really
pity.
Sorry. I want to say, you know, echo some of what Dr. Grayson is saying, which is that we have to understand that while a vast minority might be having these experiences, and they may be correlation and they may be causation, and I totally agree that we need to keep collecting data and keep being honest with people, all of it. It's really important in my mind, from a public health perspective, that we take the minority of experiences with the vaccine and couch it within how effective the vaccine is in combating a pandemic that has killed hundreds of thousands of people. And so while I am so sorry that you're having this awful experience, and it sounds torturous and terrible, the pan out of how many people we've lost, what our alternatives are, how important it is to move forward as a society and stop this vast loss of life, that's the perspective that we have to take on both ends. And I want to recognize, you know, I'm very glad that you brought this up. I could not see the questions you're sending to host. I was not the host. So if you sent something over and over, I didn't see it. I want to recognize that it's 1:08 and our panelists are over their time here with us today, and they've generously agreed to stay on. I'm happy to keep having that conversation with you offline, but I do want to cut off the conversation here because they have.
Yeah, that's fine. I just, you know, I was actually just telling Dr. Grayson that probably there are communities that are getting even less information, a whole lot less information than the kind of information that I'm getting. And that creates a lot of mistrust, because I think information, bad or good, let us be the judge if we want to sacrifice our lives for the good of everybody, but give us the information. We deserve to know.
Yes, and this is a larger societal problem.
Most likely I would make the same decision, but I agree with Dr. Grayson. We all deserve to know, all of us.
Yeah.
Good or bad.
Agreed.
So the only thing I would add on that, and again, I would echo Dr. Rodman-Alvarez, is, you know, I am sorry for what you've gone through. The other piece is making judgments based on information as a collective whole, right? I think we all make judgments based on our own personal experience, but that's not fair, because I think there are other people who could look at it from a collective whole and understand that a little bit better, right? So you know, we want to make sure we don't want to jump to conclusions based on our own personal experience, and that's what we're hearing, but we also want to make the right information. It's kind of, you know, if you could, anyone could blog anything. And this is what I tell my patients. People will say, I read that I should do this, right? And anyone could blog anything. That's one person's personal experience. But what I always say is, go to where
that's why the information needs to come from,
but
the authority.
You also want to go where the facts and the evidence go. You're a scientist. We do that. We look at where peer-reviewed articles are. You don't go to a blog to get your medical information. You go to the CDC. You go to places that have peer-reviewed articles, journals. So that's kind of what we're doing. We're collecting that information so that we can have a holistic view of it. And so I think that's kind of the only thing I would add is we want to make sure it's a collective, peer-reviewed, consensus, data-driven scientific recommendation.
Right, but it has to be available to all of us so we can make informed decisions.
Yes,
That's
and
all
that's
I'm trying to say.
I think that you're absolutely correct, and that's a health literacy issue, and it's an education issue that Dr. Grayson touched on earlier. I'm going to close the conversation now. I really appreciate
And
it.
it's accessibility issue.
Yes, it is. And this is why we have to have the health equity perspective in all of these conversations. I hope we can all work on those issues. I don't think we'll solve them here today. But again, I want to just thank our panelists. Thank you for staying late. I really appreciate it. And I will be in touch with all of you to kind of, have thoughts and wrap up this conversation and send any questions that we didn't get to. So thank you so much.
Thank you so much for your time. It's a pleasure. Have a good one. Take care.
Bye-bye.